Hello, dear colleagues. Thank you for the invitation. This is my first time in Porto Alegre, not in Brazil. I often come in Brazil, and I love this country. It's wine and it's meat, and the people too. Anyway, we are experiencing one revolution among many others, but this one is very particular. I mean, suddenly in 2023, ChatGPT 3 arrived, and it was a big surprise for everybody. And it was a big surprise also for computer scientists. We are going to see that they couldn't imagine that their model could do such a thing. And so we are all dealing with artificial intelligence today. We could think that psychiatry is far from that, because psychiatry is really related to human interaction, far from computer. And my guess is that this is definitely not the case. Child and adolescent psychiatry will face and will have to deal with artificial intelligence much more the other medical specialty, in particular surgeon, for instance. First one, AI in child and adolescent psychiatry is already there. So there is no need to say, do I have to deal with that or not? AI is already there. This is a randomized control trial published in 2025, a randomized control trial evaluating the efficacy of a chatbot, of a large language model, in the treatment of some mental anxiety and depression, to say it. And the randomized control trial is positive, and there has been a measurement of therapeutic alliance, which is the best predictor of efficacy of psychotherapy. The measurement of therapeutic alliance between the AI and the patient is similar to therapeutic alliance of a therapist, a human therapist, and a patient. Don't be scary by that. Don't be scary by that. It does not mean that we are like AI. No, definitely not. We have a body, we have a sexuality, we are afraid to die, we have parents, not AI. And so, of course, this is very important in our relationship with patients. But anyway, our adolescents, patients in particular, will benefit, some of them, from psychotherapies by AI, and some even will prefer psychotherapy with AI than psychotherapy with psychotherapists. And so big question are who, when, how do we have to deal with psychotherapy? This is a new way to practice, and of course, because there is a lack of psychotherapists, it will be for the best for our patient if we are wise in using this treatment. But also, AI will allow to do some kind of augmented clinical practice. There is augmented reality, and there will be augmented clinical practice, and it already exists. These are in beta testing. It means that in real time, you will have an LLM that is listening to what says the patient and the parents, and which show to you on the screen how the patient is different than last week or last month. Why didn't you ask this question that is very important, say the LLM, etc., etc. So it will be like an assistant that you have permanently, suggesting some questions, some ideas that you could have in the interview, and even measuring the monotony of voice that could be a surrogate of a mood state or something like that. And okay, that's life. That's life. Surgeons use robots at the moment. You know that. And some surgeons, in particular old surgeons, say this has no interest for me because I am used to do surgery, and robots does not help me that much. And some young surgeons that are less experienced say, well, I am much better when I use a robot. And I'm quite sure that it will be the same for augmented clinical practice. I'm not sure I will like to do that, because I am used to do my clinical practice as I do for 30, 35 years. And so dealing with a computer, it will disturb me. But I am sure that some colleagues will benefit from that. And so the big question will be to what extent, in which context, how we will have to train to do clinic like that, a new way to do the clinic. Okay. For research too, now in my lab, most of statisticians are doing statistical analysis with AI. That's life. So 40 years ago, we have to teach mathematics. 20 years after, no more mathematics. We just had to learn how to use computer to analyze data. And today, we have to learn how to use AI that will use the programming language and that will do the analysis for you. And so this is society change and research will change. Doing qualitative studies, you could think that it is only a human being that is able to do a qualitative studies, interpreting a text. And indeed not, we can use large language model to do qualitative coding, and it works. Here is a paper that we published in the ECAP journal this year, where we did a human qualitative analysis and an LLM assisted qualitative analysis, and it was a very interesting complement analysis to triangulate both approach. And most of qualitative researchers now know that it is inevitable today. And measurements, we all use scales, even for clinical practice, and perhaps this is the end of scales, because now you can do an interview with an adolescent, you record the interview, and you ask to the large language model, give a number that means if the patient is depressed or not. 1, no depression. 10, high level of depression. And with the interview, the large language model is able to rate what is the level of depression, of anxiety, etc., etc. And in fact, you can test reproducibility, and it is much closer to the real phenotype of patient because you are not prisoner of items that are stick and that are frozen for eternity in a scale. So you see, big deal, big things that are going to change, but in fact, the point is that AI will not do only that, and what I mentioned now was just what is over the sea, that is emerged. In fact, AI will also imply other things on a theoretical point of view. AI is likely to lead to new possibility to conceptualize the mind, to think again psychopathology. I'm sure that many of you can feel a little bit disturbed by psychopathology today, because on one side you have neurobiology, that is some kind of psychopathology. You have cognitive neuroscience, another way to think about psychopathology. You have phenomenology, you have psychoanalysis, other ways to consider psychopathology, and none of them are really concordant each with the other. And AI is likely to provide a unifying framework to understand psychopathology, and this is now where I want to go with you. And first, with some anecdote, just funny things, speculation, but you will see that perhaps it will make something interesting for you on a clinical point of view. And the second part will be the big deal, the conclusion, where we will work on a paper that gave the Nobel Prize to John Hopfield last year. So first, there is the question of emergence. Large language model, as you know, they are just estimating the most probable words that are likely to follow a prompt. For instance, if I say tomorrow evening, Louise will go to the restaurant, to the airport, to the gym, you will all have in your mind a couple of words that are likely to be consistent with the dots. And the large language model do exactly the same thing, and after it randomizes one possibility and it proposes to you. Okay, and it works. It works. But now if I write this prompt, 534 multiplied by 926 is. Cognitively, for you, this is completely different. This is not possible to guess the answer because you will have to do the computation. And at school, you learned how to do a multiplication. And doing a multiplication, this is not like guessing what Louis is likely to do next evening. And indeed, at the beginning, when they used ChatGPT-2, GPT-2 was not able to multiply figures, but GPT-3 and 4 was able, and it was not foreseen by computer scientists. And there are papers which suggest that there has been some kind of emergence of phase transition. Phase transition, this is like when you have liquid water, you decrease the temperature and suddenly you have no more liquid water, you have frozen water, suddenly. And when you look at the figure, you have, according to the number of connection of the neural network in billion, so you have at the beginning 0, that is, it does not work. The LLM is not able to do any computation. And just in increasing the number of connection, when they arrive to 100 billion, suddenly they are able to do the computation. This is an emergent. And so perhaps our brain has worked exactly like this during the evolution. Perhaps our brain was more and more complicated and suddenly it was different and we were able to speak, to engage in communication, etc., etc. Suddenly we became human beings. Attention. Here is a large language model. You have an input, a text. The text is cut into pieces, token. The pieces are transformed in numbers. This is the embedding. Then you have a transformer that do some kind of huge computation, and then the output, the answer of ChatGPT. But within the transformer, there is an attention network. And of course, there is a congress just at the moment about ADHD, and so attention is very important for us. And for an LLM, attention is a vector of weights. Vector of weights assigned to each word of a sentence. On a psychological point of view, it means that at the moment, you have full of stimulation. I speak, you see things, you may be cold or warm, etc., etc. Plenty of stimulation, and you weight all this ponderation in order to optimize your brain functioning. Optimize the brain functioning. And so what happens in ADHD? As we say in the clinical practice, it does not work that well. But there are two different ways for which it could not work that well. First, perhaps the weights are not assigned correctly. That is, the neural networks that assign weights does not work. And so, perhaps because of genetics, because of genes, the brain is not structured that well, and so we have to help these patients because they are designed not enough well to deal with attention. But there is another possibility that we see from time to time with the clinic. Perhaps this way optimize an output that is not compatible to our optimization of output. Some kids are just fine with ADHD. This is just the fact that they are not compatible with the school or with the society. And the school or the society consider two different ways of optimization. And here, when we treat this patient, there is indeed an ethical problem because, in fact, we treat them because they are different and not because there is a bug in their brain. This is speculation. But you can see how thinking with LLM can help us to think about patients. Learning. We have seen yesterday that learning is something important. Learning with an LLM corresponds to parameter estimation. With GPT-4, you have more than 1 trillion of parameters. And so you have to estimate 1 trillion of parameters. And this estimation comes from a bottom-up process. That is, You are trying to use your model and it gives an output, and after you say, is this output is fine or not? And you have to do that billion of time to estimate the good parameters. When you have 1 trillion of parameters, this is not tractable. It would require centuries of years to be able to estimate all the parameters. And this is the reason why computer scientists say we have to pre-train tokenization, embedding, etc. They pre-train, and once they pre-train, then they can do fine-tuning, that is just slight modification of the weights so that the global model is effective. If you consider our brain, when there is a newborn, as you know, a newborn is not a tabula rasa. A newborn has already connection, and this connection comes in particular from the genes. For instance, you know that a newborn is able to put his attention or her attention with 2 A's. They look at A's, and of course they are pre-trained to look at for A's, and perhaps, you know, with autism, perhaps there is some kind of bug with that. And so, in fact, perhaps we are just like LLM in this way, because our brain is so complex, this is not impossible to design a human brain without pre-training. And so we need our gene to do some kind of pre-training. But according to the animals, you can imagine that ants do not really need to be fine-tuned. The ants are all similar, and the genes for ants are enough to provide an ant. But for a human being, during 9 months, there is a pre-training, but during years, and being first with parents, and then in school, and being an adolescent, etc., there is some kind of heavy tuning. And so there is not only genes, there is also culture, and you can see that both, in fact, converge to create a human being. The last anecdote is about, I'm sure you have all tried to discuss with ChatGPT, for instance, and this is funny because you have the feeling that you are discussing with somebody. But to whom are you speaking? Here I am speaking to yourself. Perhaps I am speaking to ourselves. Perhaps I speak to myself too. And you know that human beings are able to speak to themselves. This is called inner speech, and which is funny. In fact, not all human beings have an inner speech. About 5 to 10% of the population has what is called anandophasia, that is the impossibility to speak to ourselves. And in fact, this guy, perhaps there are some in this room, and there is no problem with that. On a cognitive point of view, this has been studied in the paper which is here. In fact, there is no big difference between people who have anandophasia and so-called normal people. Anyway, when I am speaking to LLM, to ChatGPT, to whom I am speaking, my feeling is that I am speaking to one self. What is one? In fact, you know that the LLM is designed by the whole content of the internet. That is all what human beings wrote on books, on blogs, on websites, etc. And so this is the synthesis of all that, and this has created a new entities that you can label one. And when I speak to ChatGPT, I speak to one self. And anyway, this is a new entity that has emerged in humanity. No more you, no more me, there is also one, and we can speak to oneself. Okay, now it was the appetizer. Now we are going to enter in the big deal. The big deal comes from a paper published in 1982 by John Hopfield. John Hopfield had the Nobel Prize more than 40 years after, last year, and which is funny that John Hopfield did work on neural networks, and he had the Nobel Prize in physics. And physicists were a little bit embarrassed by that. as you can imagine. Anyway, and John Hopfield, on my opinion, wrote one big paper, and this is this paper. And during the 20 minutes I have left, I want to discuss with you this paper, because indeed it has huge implication in our job. Of course, it is a little bit technique, but don't worry if there are technical things. They are not necessarily mandatory. Anyway, this is the model that John Hopfield proposed for neurons. You know that neurons are interacting, there are axons, etc. And when you have neuron upstream that are activated, the neuron downstream is likely to be activated also. So this is very basic. You have neuron N2, N3, N4, N5, N6, and they have an implication on the level of activation of N1 according to the formula. If you have many activating neuron upstream, then the downstream neuron is likely to be activated. And so this is a brain. This is a small brain. You have neuron, a formal brain. You have neurons that are activated or deactivated, and they interact all with all other. And so you can consider that a brain is a sparkling cloud. That is, you have particles that are on or off, and with time, they change. This is a sparkling cloud. And so the question is, do the brain will sparkle all the time, or will, at a given time, it will converge and stop? And Hopfield proved that indeed it will stop. And he developed the notion of an energy of a brain. This is funny because Freud did the same thing at the end of the 19th century. Anyway, this is just a funny thing to say. So he developed an energy of a neural network, and it shows that with time, this energy can only decrease. And so, on a mathematical point of view, at a given time, it stops. Okay, this is very abstract, but let us see more precisely what it means. So at a certain point, the network converge and stop, and when it converges to a fixed pattern, and this fixed pattern will be called an attractor. Now we can do an experiment. Look at this picture. You can see plants, you can see piece of wood, and can you see something that is a little bit strange? You see there is an insect. Can you see the insect? Yes. It is a phasma. So what happened in your mind? What happened in your mind? You saw the picture, and at first you see plants, etc., but you know that there is something else. And so your brain sparkle, and suddenly you see the insect stop. It is stuck in the attractor, and now you see the insect, and your brain do not sparkle anyway. And so what happened when you saw the insect? You had consciousness of the insect. Before, you had no consciousness of the insect. Suddenly, you see the insect. Before, you saw it also, but you didn't have any consciousness of the insect. Suddenly, you see the insect, you have consciousness of the insect, and in fact, practically, when you arrive to a low level of energy, to a minimum of energy, this is what we human beings consider as having consciousness of. So explaining what is consciousness is not a small thing. And the other interesting point about Hopfield paper is that it shows that the attractors correspond to memorized situation. Indeed, if you never had seen any phasma in your life, you wouldn't have been able to be aware of the phasma. You can only have consciousness of something you already saw in your life. And the more you see things, the more you memorize things. When you are a teacher, you know that. Teaching is repeating. Teaching is repeating. And the more you see, the more you teach, the deeper is the attractor. And it will be even easier and easier to go in the attractor and to have consciousness of this attractor. Now we can represent that graphically. This is a little bit complex, but don't worry, the picture will be easy. You see different pattern of activation, and you will see that these pattern of activation, they differ only from one stimulation. And so we will represent that each pattern of activation will be 1 point, and we will put a line between 2 points if the two corresponding patterns differ only by 1 neuron. And also each pattern has a certain level of energy, and we will represent each point at an altitude that corresponds to the level of energy. And so, here is the representation. Each node corresponds to a pattern of activation. And when you go from one plot to another plot, there is a change in a unique neuron. And the lower you are in the level of energy, the more stable will be the corresponding pattern of activation. And we saw that energy can only decrease. And so when your brain changes, you can only decrease in this picture. And when you are at the bottom, then you cannot move anymore. You are at the bottom of the attractor, and you have consciousness of what is at the bottom of the attractor. And it is really funny to see that, in fact, we think like that. Imagine you will come back home in a couple of hours, and you are looking in your pocket and you have no more keys. And you will say, where are my keys? And you will sparkle in your brain, and you will see, in my car, etc. I was in the hospital, it was Saturday, I've forgotten my, and because I drink caipirinha yesterday, and so I am not cognitively active, and so I have forgotten my key in the office, and you know that. Perhaps it is not true, but in your mind, this is true. And so, in fact, human mind is fundamentally associative. When we try to remember, we associate. And this is very different to computer. You know that memory with computer, memories are just in some pieces of the microprocessor. Why for human mind, human brain, we remember in associating ideas. And when I say I remember, it means that I am at the bottom of the attractor. And of course, if I say human mind is fundamentally associative, you understand that I will mention that psychoanalytic work is based on association. This is exactly what you do when you are with a psychoanalyst, you associate. And in fact, with most therapists, you associate too. Even if you do a CBT, you associate. Human mind is also categorizing. You see a cat. No, you arrive at home in your car, you see a cat, and you say, I see a cat. So you are in the attractor cat. I see a cat. But when you come closer, you say, it's my neighbor cat. It's my cat. So within the attractor cat, there is your neighbor cat, and there is your cat. And because you know better your cat than the neighbor's cat, the attractor my cat is deeper than the attractor my neighbor's cat. And okay, you will say this is very speculative. It is. But speculation is not that bad. But okay, you will require perhaps something more serious. And so I have done some simulation of a brain like that, and this simulation concern what we could consider as the visual brain of a child who is on an island with his two parents. And typically, the child faces three situations. First, the child sees his mother's face. Second, the child sees his father with his mother. And third, the child sees the boat where his father or his mother is going to take fish. So the mind, the representation of the mind and not the brain, this is the representation of the mind. This is not a representation of the brain. The brain, it is the neurons. The mind, it is the universe of all possible state of activation of the neurons. And each state of activation corresponds to what is your mind at the given moment. And so the baby, the child mind is designed with three big attractors: mommy's face, mommy and daddy, and both. And so, if mommy's face is half hidden, what will happen? The child will face mommy's face half hidden, and it will sparkle, and it will converge where? It will converge to mommy's face. And this is why, when we see a person we know with a half-hidden face, we see only the half-hidden face, but we have consciousness of the person who is behind. And so let us see on the simulation. Here is what I provide to the computer, and now let us see where it will go. And progressively, the brain sparkle, and it converges to the mommy's face. Okay, and now, if the child sees his mother alone, it will converge with mommy and daddy. Because when I see my mother alone, because I see often my mother and my father all together, if I see one alone, I will converge to the attractor, one is with the other. Let us see if it works. It converges progressively to the attractor, mother and father. And also, if there are psychologists here, you know that a big problem for human beings is that they will never be able to be alone with their mother, because if they are with their mother, inevitably the father is close, not necessarily on a material point of view, but we know that my mother one time was with my father and it was important, and so when I am with my mother, my father is not that far, and this is a pity. Now, if my mommy's face is too far, is hidden, but not half, but 3/4, so I do not recognize her, to what will it converge? It will converge with that. And this is funny because you see, so I don't recognize my mother, but I converge to an attractor that is a mixture of other attractors. And this is funny also because this is exactly what we do when we dream. When we dream, we all dream. Perhaps we don't all remember our dreams, but if you remember your dream, you know that in fact we see people that have the face of somebody, the voice of some other body, etc., etc. This is very well described. And in fact, this is just because when we dream, we go to some attractors that are not real attractors, they are combination of attractors. And as I say, this is a representation of my mind. This is not a representation of my brain. And interestingly, you can see that this way to represent a mind is very different to all other representation. In particular, this representation means that we are not a data processor with tools in our brain that are dealing with information like a computer. No, no, no. This is much more soft. This is not squared. This is round. This is blurred. But you will say, this is it so simple? Is it so simple? No, this is not so simple because, in fact, in our brain, there are so many neurons that the number of attractors is billion of billions. And so this is like this picture that we could represent our mind. And you have many attractors, and in this attractor you have the attractor of your patient, your cats, your kids, your mother, your sister, this table, the hospital, etc., etc., etc. And perhaps because we have met a couple of days and because I speak to you, perhaps now I am somewhere in this. Perhaps there is the attractor Bruno in your mind. And so I will remain a couple of days, and perhaps we will forget me, unfortunately or fortunately, and this attractor will disappear. And that's life. And I have a YouTube channel, and if you listen to me again, the attractor will appear again. And you can see, because of that, there is something very human, that is, we are not separated from each other. You know that with the cognitive paradigm, I am a human being, I am a data processor, I am speaking to you, you listen what I speak, and you, as a data processor, you interpret and you analyze what I say. So we are separated. We are separated. And this is in line with what Tobias mentioned yesterday, the paradigm of natural science. Reality is made of separated entities. There are atoms, molecules. In cells, you have DNA, ribosome, etc. You have organs, and you have, after human beings, we are all separated. In fact, no, we are not separated. And this happens if you have your mother or something very close to you that disappears. As you know, this person is still with you during months, during years, and sometimes during the rest of your life, it is here. And sometimes you go to bed, and if you slept with the same person during 10, 20 years, the person is still beside you in the bed. This is in a way an hallucination, but because the attractor of this person is so deep that when you arrive in the bed, like in the simulation, last number of seconds before, in fact, this person is here. So there is no, and of course, in a psychotherapy process, this is exactly what happened. You are engaged in a relation that is a long relation, and of course, there is an attractor that corresponds to the psychotherapist, an attractor that corresponds to the patient for you, and many can call that transferency and counter-transferency. This is exactly what I mentioned, and in addition, because we are designed a little bit in the same way, because we are a little bit in the same environment, we have more or less the same attractors. We have all the mother and the father. You live in Porto Alegre, you live in Brazil, and even if I don't live in Brazil, I know Brazil and I know, etc. So we have the same pattern of attractor, and when you are engaged in a patient, if you discuss, if you listen, you will succeed in having the same dynamic of mind as your patient. This is called co-thinking. And this co-thinking is something therapeutic. Will help the patient to rebuild him or herself. So it is my conclusion. What about child and adolescent psychiatry? This is just one slide. It explains a lot. On the left, you have an embryo. As you know, the brain of an embryo is something very small. And of course, you have very few attractors. This is very basic. And during the 9 months of pregnancy, progressively the brain is designed and you have more and more attractors that come from your genes, but as you know, a newborn is able to recognize the native language of the mother to another language, because the language was spoken by the mother and the father, and it goes into the uterus. And so when you have a newborn, the attractor do not correspond only to genes, but also from the environment. But after delivery, you will face the environment, your parents, some abuse or not, or some security attachment. And so you will have many more attractors, many different, and some that were designed by your genes will be raised or not. And you can see with this representation that it makes nothing, it does not mean anything to say that you have gene on one side and environment on the other side. We have a mind which is designed by what we are and by what we face. And they have both have exactly the same impact on us as human beings. And so it means that the separation between biology and psychology is completely artificial, like the separation between nature and culture, and this is exactly what said anthropologists. And this is my last slide. Indeed, AI will change child and adolescent psychiatry, first because there is the emerge part of the iceberg. Indeed, we will have to work with AI, but I say this is not a big problem. Surgeons did that, and we are able to change our practice for the best. We have just to be cautious and wise. But there is also what is emerge below the surface, and emerge below the surface is a new way, a new possibility to conceptualize a human mind that will benefit for us a lot, I am sure. Thank you for your attention.